Western Cape has recorded over 26,000 active COVID-19 cases in total, and its hospitals are now starting to fill up very quickly. The province firmly in the grips of the third wave as well. It's driven by this Delta variant. It's being predicted that the third wave could be as bad as the second wave. Now, this peak expected to come to an end at the end of this month, end of July, and health authorities are pulling out all the stops to try and make sure that the healthcare system will be able to cope with the increase in cases and hospital admissions. Here's Ayesha Ismail with the latest.
Western Cape health authorities are keeping a close eye on what is happening in Gauteng. They say this will give them a clear idea of when to expect a peak here, based on the predominant Delta virus.
But be that as it may, our picture points towards the end of July, beginning of August to be a peak. Our current prediction is that the picture will look very similar to what we had at the end of December, beginning of January, which is a strained healthcare system, which is a pressure on especially critical care beds in public and private, and a pressure on people trying to get into hospital, needing oxygen.
Kluti says they are preparing for about 3,000 new infections per day next week and up to 500 daily admissions. He says field hospitals have already been activated and are fully functional with more beds available if needed. And while the vaccination program is progressing well with about 500,000 people vaccinated so far, Kluti says community and family infections are driving the increase in numbers. The aim remains to vaccinate as many people as possible so the province can reach herd immunity by November this year.
We're trying to reach 70% of everybody over the age of 18. We're talking about 3.5 million people. As we've just said, we've got to 500,000. We've got 3 million to go. So those calculations are very simple for us to make. And therefore, what we have vaccine supply for, our aim in this province is to get that done as quickly as feasibly possible.
But Kluti says this all depends on people coming forward to be vaccinated and those still reluctant to be convinced that the vaccines are safe and can save lives. Ayesha Ismail, Cape Town.